So guys, this is Dr. Vikrant and today we will discuss a respiratory topic and that is the bronchiectasis. And that is basically a kind of an active recall जो कि 10 मिनट में हम पूरा टॉपिक खत्म कर देंगे. Okay, so let's get started. And first thing is the part 1. So part 1 is basically your anatomy followed by its types and its pathogenesis and associated with the clinical features and the complications. So let's get started. And we will start basically with a video with respect to the anatomy. Okay. So first thing is the lungs, basically your left and right lungs. अगर हम सिर्फ right lung की बात करें, and that's having only 3 lobes. Number 1 is the upper lobe, and that's having your 3 segments. Number 1 is your apical segment, and that is your apical segment, and that is anterior and that is posterior segment, right? And second one is the middle lobe, and that's having medial and lateral segments. And third one is lower lobe, having the 5 segments. First is the apical or superior and anterior, posterior, medial, and lateral segment. Upper one is having your apical and anterior posterior segments, along with which we do have lingular superior and lingular inferior segments. Okay, and with respect to your lower lobe, we do have 5 segments, and with respect to your lower lobe, we do have 5 segments too. First one is your apical segment and anterior, posterior, medial, and lateral segments, right? And next thing is your BP unit, and that's basically your bronchopulmonary unit, and this is your BP unit, and that's having your respiratory bronchiole, right? And that is your atria or alveolar sac, and these are your alveoli, and that is basically your histopathology of lung parenchyma, and that's basically made up of the type 1 pneumocytes. Okay, and we do have type 2 pneumocytes in the lesser number. Now we will discuss about the classification. First one is the etiological classification, right? And that's having 2 components. Number 1 is a focal one, right? That is focal component, and if it is occurring with respect to the adults, that's having 2 etiologies. Number 1 is your pulmonary hematoma and bronchial carcinoid, right? बहुत हवा चल रही भाई यहाँ तो मौसम बहुत अच्छा हो गया. चलो हाँ. And with respect to your diffuse variety, right? And we do have several etiologies. Number 1 is the bacterial infestation, and examples including the Pseudomonas, followed by the Haemophilus influenzae, the Staph aureus, and the Burkholderia cepacia, and followed by the Pneumococcus. And these are the organisms causing the bronchiectasis. And second etiology can be your decrease in the clearance, right? The impaired clearance, right? And mucus is basically sole for what? For the growth of the microorganisms, right? And examples can be your cartilaginous syndrome and cystic fibrosis, Young syndrome, and last one is the antitrypsin deficiency, right? And these all are etiologies with respect to the impaired mucociliary clearance, right? And next one is the autoimmune diseases such as Sjogren's syndrome, RA, rheumatoid arthritis, and followed by IBD, that is the inflammatory bowel diseases. And these are basically your etiologies causing the bronchiectasis, but these etiologies, the autoimmune disorders, can also cause the restrictive lung diseases, right? And next one is basically your immunodeficiency disorders such as the IgA deficiency or CVID. Okay, now we will go for the morphological appearance. Okay, normally the bronchi appear to be like a tubule, right? And the bronchiectasis is manifested as like the cylindrical variety, the varicose variety, like the varicose veins that is appearing, and next one is a cystic variety, and since that is appearing like the cysts, right? And next one is your types based on the location, okay, location of the bronchiectasis, right? And it can be your upper lobe, such as the cystic fibrosis, since that is occurring at the apex, and it can be your TB, since the focus of TB is appearing at the apex, right? And next one is a post-radiation fibrosis, and because of the radiation exposure during the radiotherapy, and that's causing your the fibrosis or the bronchiectasis. And next one is middle lobe involvement because of 2 reasons. Number 1 is the Williams-Campbell syndrome, in which there is deficiency of cartilage in the bronchi ranging from 5th to 6th number, right? And next one is the MAI, such as the non-tubercular mycobacteria, and that's causing the infection. And that is basically your Mycobacterium avium complex, right? And next one is the scleroderma, aspiration because of the gravity. Okay, and next one is hypogammaglobulinemia, and next one is the interstitial lung disorders, and that's basically involving the lower lobe of lungs, right? Now we will go for the pathogenesis of bronchiectasis. Right? And if it is because of the infection by the microorganisms, the pathology starts from this point. And if it is because of the defect in the mucociliary clearance, the etiology and the pathogenesis is started from this point, right? And since this mucus is made up of the glycoproteins, and that's why that is consumed by the microorganisms for their growth purpose, right? Colonization of and followed by your colonization of bacteria, and since that is causing the injury resulting into the inflammatory reaction, and that is basically your neutrophilic infiltration, right, and followed by the tissue injury, and that is causing the destruction and distortion of the airways, and that is causing basically the irreversible dilatation of bronchi, right. So now we will discuss about the clinical features of bronchiectasis. Number one thing is the productive cough, and second one is the bronchoria, and the definition is the production of mucus, the water mucus, okay, more than 100 ml per day, and that's basically your bronchoria. And next thing is there is breathlessness or dyspnea on exertion, and followed by the halitosis, and that is basically your bad breath. So what are the signs of bronchiectasis? Number one is the clubbing, right, and normally we do have the Shamrock sign, and that is having the diamond shaped cavity, okay, and that is formed between the proximal nail fold and the nail plate, right, and that is absent because of the clubbing, right. And second thing is there is going to be the presence of the early and mid inspiratory crackles can be associated with the bronchi. So now we will discuss about the complications of bronchiectasis, right. So first one is the cor pulmonale. So what is occurring here is that there is the destruction of parenchyma, and that is causing the hypoxia and resulting into the vasoconstriction of pulmonary vessels, and that is causing the pulmonary artery hypertension and causing the right ventricular failure. And the next thing is the massive hemoptysis, and followed by your secondary amyloidosis, since it is the chronic inflammatory condition, and followed by the lung abscess formation, right, because of the separation and because of the growth of the bacteria, right. And last one is the empyema, along with the bronchopulmonary fistula, and because of the extension of this infected bronchi to the pleura, and hence causing the fistula formation and resulting into the empyema.